I'd like to ask you a little bit about the journey that led you to specialize in mental health. And were there any earlier experiences, anything to do with personal or patients, that influenced your decision to focus on mental health today?
I became real fascinated with what's going on in the anatomy of the brain for traumatic brain injuries at first. And then I started thinking about addiction. What does an addicted brain look like? And I just was really fascinated with the neuroimaging. And that led me to I was one of the first people to get a PhD. I was coming of age, scientifically and academically when internet addiction was kind of first and foremost, kind of hitting the scientific world. There was a big argument as to whether or not it existed, and started doing research to kind of support the argument that hey, there is problematic online behavior out there, and so I was one of the first people to get a PhD in this topic, and I wrote a couple of papers on it that got me interested in that group of people to treat as patients. So when I went into the hospitals, I realized that those people weren't coming to the hospital for help. That they were looking online for help, and sometimes the help that they were finding wasn't really high quality. So I started a digital health business, and that got me introduced to digital therapeutics and lots of other med tech products, and that led me down this route where I'm actually able to bring products that help people directly to their device.